Colorado will once again lead the way in building a new drug industry. We're one of the first states to legalize psychedelics and create policy around medicinal use. A group of local researchers says it's really important to get this rollout right.
While the class itself, psychedelics and hallucinogens, have been used for a very long period of time, millennia in some cases, this is the first situation where they're being approved or potentially being approved for medical use by trained practitioners.
Colorado is at the forefront of regulated psychedelic treatments. After voters approved psilocybin for medicinal use back in 2022, researchers like Joshua Black and his team at Rocky Mountain Poison and Drug Safety Division are about to get a whole lot of new post-market data about psychedelic drugs.
We want to ensure that we're collecting the right information now so that in the future we can make decisions around safety, around efficacy, around whether individuals need to change the way the substances are being used to maximize the benefit and minimize the harm.
In a study published last month in Nature Mental Health, Black's team says we can't forget to track things like why people are using psychedelics and if they're using other drugs at the same time or have other health conditions. They'll also need to track the experience and training of the provider assisting the patient, and if the drug has the intended effect, a bad effect, or even symptoms that show up later.
Happy 420!
And Colorado has done something like this before, leading the way with legal cannabis.
When we think about psychedelics, and we're at that same cusp where a few smaller group of people are using and that group will grow over time, do we see those rarer events? The biggest thing we can learn is that rare events in a small population become much more frequent as that population gets bigger.
So Oregon is a few steps ahead of Colorado, with psilocybin treatment facilities already legalized and in operation, serving patients with mental health diagnoses. Colorado's still working through making our state's rules and plans to take applications for natural medicine facilitators by the end of the year.